Parts of Sussex County are turning teal. The towns of Lewis and Georgetown are just two Delmarva cities turning the towns teal. It's all part of a national campaign to help raise awareness of ovarian cancer. The teal ribbons will be on display for the rest of September.
And another place you'll be seeing teal is on the racetrack. Several Sprint Cup Series drivers will be sporting the shade of blue in honor of Martin Truex Jr.'s girlfriend, Sherry Pollux. Now, Sherry was diagnosed with stage 3 ovarian cancer more than a year ago, and together she and Martin are trying to raise awareness for the disease. Driver Danica Patrick will sport this teal accented steering wheel, and she, as well as Dale Earnhardt Jr., Ryan Newman, and Casey Kane, will be wearing teal accented racing gloves. Interesting. Well, along with awareness and more importantly comes a search for better treatments and a cure.
And it turns out researchers may have found what's good for the heart may just be good to help win this battle. More than 1,400 women with epithelial ovarian cancer participated in a recent study where beta blockers were used. Turns out women who received the drug had a more than 5-month increase in their survival rate than those who didn't. Beta blockers are typically used to treat a variety of conditions like heart failure, high blood pressure, and migraines. So what is ovarian cancer?
Who's most affected?
And why is it so deadly?
Well, first, ovarian cancer is a growth of abnormal malignant cells that begins in the ovaries. It then spreads two ways, directly to other organs in the pelvis and abdomen, or through the bloodstream to the lymph nodes. Each year, nearly 250,000 women are diagnosed globally, and according to the Ovarian Cancer National Alliance, more than 21,000 new cases will be detected this year here in the U.S. Ovarian cancer has the lowest rate of survival of all female cancers, killing 140,000 each year worldwide and more than 14,000 in this country. And statistics show that less than 45% of women with the disease are likely to survive 5 years. Now, many call ovarian cancer the silent killer, but it does have some symptoms. They include bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, and either urgent or frequent urination. Now, your risk for ovarian cancer can be genetic. It can increase with age, be a result of hormone replacement or reproductive history, and infertility.
Well, one of those causes of infertility could come from a fairly common condition that many women have probably never heard of: polycystic ovarian syndrome, or PCOS. As many as 5 million American women suffer from the condition that wreaks havoc with the woman's menstrual cycle. Experts aren't sure of the exact cause, but they do know that a hormone imbalance plays a part. Here now are some symptoms and preventative measures women at risk can take.
I design women's apparel, everything from formal wear to ready to wear.
Nat Taylor always imagined that life in her 20s and 30s would also follow a well-designed plan.
You go to school, you graduate, you get married, and then you have kids. So I graduated, I got married, and it was like, okay, why am I not pregnant yet?
Nat was having trouble starting a family. There were other health problems.
I started gaining weight out of nowhere, and I just chalked it up to me eating a lot.
Mary Jane Lewitt is an expert in obstetrics and women's health. She says unexplained weight gain and infertility issues are two signs of a common condition many women have never heard of before: polycystic ovarian syndrome, or PCOS.
The hormone levels are elevated, which is causing some maturation of the eggs on the surface of the ovary, but they don't ever get the indication to release any of them and ovulate.
Other signs of PCOS include excess body hair, dark patches of skin, and absence of a menstrual cycle. Because a hormone imbalance is a potential cause, treatments include supplements or birth control pills, and losing weight can also help.
That's one of the fastest things, and a lot of times the ovarian response will come back very quickly.
For Nat Taylor, knowledge is power.
There are a lot of women who have infertility issues, and they have no idea what caused it.
Knowing she has PCOS gives her a place to start. Now, with polycystic ovary syndrome affecting 1 in 12 women worldwide, treatment is not one size fits all. That's why some researchers are looking for a non-medicine approach. A few years ago, you never would have found Grace Pickering in a gym.
Throughout the study, I lost inches and about 20 to 25 pounds.
Now 28, Grace was diagnosed with polycystic ovary syndrome, or PCOS, at age 12. The first symptom is an irregular menstrual cycle.
And you can see how much bigger the ovaries are.
The ovaries become enlarged and small cysts form on the outer edges. The result is that many women don't ovulate and can't become pregnant. Dr. Leanne Redman is leading a study called PULSE. She thinks diet and exercise could be the key to treating PCOS.
We're very excited about this study because really what it's doing is trying to understand how, not only how diet and exercise help the infertility, but how diet and exercise are affecting the signals that are coming from the brain, these certain hormones that are interacting with the ovaries.
The 6-month study randomizes participants into 3 groups. One focuses on dietary restrictions, one on exercise training, and the other on the diabetes drug metformin, which is currently used to treat PCOS. Grace ended up in the exercise group and spent 6 months using Pennington's Gym free of cost. She also got to work with trainers to develop a personal fitness plan that's really paid off.
Since the study, I've been trying to be consistent with working out, and I've lost about 20 more pounds.
Her menstrual cycle is also more regulated, meaning she's more likely to get pregnant when she's ready.
PCOS has become more common, and so we do know it's affected by our lifestyle. So that's why our lifestyle program should be the first choice of treatment for many women that are seeking fertility, because then the outcome is a healthier mom gets pregnant and hopefully we get a healthier baby.
It's yet another reason why regular exercise is critical to good health. PCOS is diagnosed with a doctor's exam, and sometimes a blood test or ultrasound may be necessary. Experts say if PCOS is untreated, women are at increased risk for diabetes and cardiac disease. PCOS in older women increases the thickness of the lining of the uterus and puts women at a higher risk of endometrial cancer. As for the hereditary risk, the girls are 50% more likely to get it if their mothers had it.
Well, if that's not enough for young women to worry about, there's also an infection that can cause cancer and infertility down the line. And guys, this one can affect you too. Up next on Delmarva Life, we learn about HPV, how it affects both boys and girls, at what age you can start getting and stop getting the vaccine to prevent it, and why some believe benefits outweigh the risks.
And it's hard enough when you're diagnosed with cancer as an adult. Now think about what it must be like for a child. A little later, we introduce you to a mother and father determined to save as many children's lives as they can. Delmarva Life, we'll be right back.